I'm Riata Pierce, the Heart Disease Manager at Wellhead, Louisiana. Thank you so much for joining us today. Today's webinar will focus on community clinical linkages and how your practice can work with community-based organizations to improve the residents' health in the places where they are and encourage them to seek out healthcare services when they need it. Before we get started with our presentation, I have a quick announcement. As we close out June, which is Alzheimer's and Brain Awareness Month, we want to share some resources on this topic that you can use in your practice. First, honor the strength and perseverance of Alzheimer's community by reviewing the principles for dignified diagnosis. This card shares a series of statements written by those who have experienced being diagnosed with Alzheimer's disease. They request honor, open communication, and respect from their healthcare provider to handle this difficult diagnosis. The Alzheimer's Association also has resources that can help you make timely diagnosis of and treatment plans for Alzheimer's disease and other related dementias. You can check them out at the web address provided. These tools are part of the Alzheimer's Association partnership with medical experts to address the rising costs of dementia and improve patient experience and outcomes. Our speaker today is Dr. Larry Proctor, Assistant Professor of Kinesiology at Grambling State University. Dr. Proctor is also the owner of BEAM, a preventative healthcare agency providing health and wellness programs to lower the disparity of cardiovascular disease relating to socio-cultural and racial differences. Thank you for presenting today, Dr. Proctor. We look forward to hearing from you. Today, we want to share with you about community clinical linkages and the importance of providers working with community-based organizations who are providing these services outside of clinical settings. Finally, Dr. Proctor will share his experience in providing health information to fellow members of his church, New Living Word Ministries, specifically the community-based blood pressure monitoring program. Community clinical linkages serve as a connection between the community and clinical settings to help improve population health. By developing partnerships and connecting communities, you can improve patient access and preventative and chronic care services and reduce preventative disease in our communities. By offering community-based programs, residents can learn more about their health outside of a clinical setting. Once they are aware of healthcare risks such as high blood pressure or prediabetes, they are then connected to you and your practice. Wellhead will work with you and the community-based organization on establishing, facilitating, and evaluating the program. Community-based blood pressure monitoring programs or community-based BPM programs use a community-based organization to provide on-site blood pressure screenings for the community members that organization services. That organization is provided with supplies and educational materials for community members to measure their blood pressure on an automatic blood pressure cuff, receive health education to understand their screening results, and provide referral information to medical services to ensure follow-up care. This programming targets individuals with uncontrolled hypertension who may not have a medical home or who are not under the care of a medical provider. Working with your practice, the individuals would be referred to you for medical services that meet their needs. Wellhead helps close the circle by evaluating the number of people screened for hypertension and the number of those with high readings who need further medical assistance. Next, we will hear from Dr. Proctor about the work he is doing through the BEAM initiative, particularly implementing the self-monitor blood pressure program through his church, New Living Word Ministries. Dr. Proctor, you're still on mute.
Thank you for that. I told you I would need some help with this. So what is BMLC initiative? It's a health disparity initiative designed to protect health status by way of providing fitness challenges and health awareness sessions. So we're actually meeting people on the ground. We're the boots on the ground, getting the project done within the community. And education, of course, goes with application. Next slide. Our presence in the community gives us a unique opportunity to provide affordable preventive healthcare services, culturally appropriate, and something that helps to lower the healthcare cost within our nation. But we need trained associates on the ground. These are the boots on the ground again that I spoke of, that is so critical for this project. So as our health and wellness program has evolved over the years, it's been able to reach people and provide a critical preparation process, putting it in place across the state to enhance the health of the people within Louisiana. Next. So how do we do that? We have fitness challenges. Our fitness challenges is the method of testing and measuring blood pressure and a host of other health metrics and indices. We measure 12 different indices and give information, feedback information to the participant as to what that means and how that relates to them and their health. And so we do this initially by a pre-test, and then of course a post-test follows at the end, where we compare their progress from the initial to the end of the project. And so your program doesn't have to provide, all of the things that we do. And of course, this is a 15-year project for us. And so as you get involved, you get in where you fit in, and we tailor the program to the capacity of the church. So once we've identified people who might have issues, additional issues that we can't manage, then we turn them over to our partners. We refer them to our partners, Northeast Delta and the Health Hut, who provide indigent care for those in the region. Next slide. So why is measuring blood pressure important? Because it's the leading cause of death on the planet. Roughly 30% of the people in the US are affected by it. And while blood pressure is the tool that we use to monitor your health risk for heart disease and stroke, it's not destiny, so to speak. So keep in mind that it's only a tool that we use and doctors use to manage patient care, trying to determine whether you have hypertension, hypotension, or other heart conditions. Go ahead. Challenges to measuring blood pressure, knowledge of how to measure blood pressure. So patient care, and then relationships with that individual. Workflow constraints might be an issue as well with regard to inadequate time preparation for people. Doctors have you on a time slot when you come in, and people may need more time. Multitasking might be an issue. Calibrated equipment might be an issue as well. And then people might have some cultural nuances related to being fearful of the white coat, so to speak. And then, may come from a low socioeconomic status. African-American women tend to take better care of other people than themselves, neglecting self, and then African-American men tend to see getting assessed as being something weak or something that inappropriate for them. So we have these cultural challenges that may hinder us from getting our blood pressure checked to begin with. Go ahead. So the initiative starts with community encouragers. So we engage with people who we train from each agency, and those people could be from the Boys and Girls Club. It could be from a health and wellness organization like we worked for hospitals before in the past, or other churches. And all these experiences have been summarized into themes as follows. So what you see here is the community encourager. The community encourager position is almost the most important aspect of a wellness program because those members alleviate, the time constraints on a minister or a pastor. The pastors bring the word, communities encouragers bring the wellness, so to speak. And so while pastors don't have a focus on wellness, communities encouragers do. And this is my life's work. It's near and dear to my heart. I'm a community encourager as we speak. Continue. Also important in the initiative is the presence of an active health ministry. And what we mean by that is an ongoing ministry or something that occurs year round, not a health fair or a seminar that may happen once or twice during the year, but something that happens throughout the year. Our health and wellness program occurs year round, and therefore people can learn from that. They can learn because they have constant engagement and interaction. Cultural wellness within the church, a culture of wellness within the church. What do we mean by that? We've been doing this now for 15 years now. So we've learned some things that can help us sustain what we've been doing. And these are some of those lessons learned. The first lesson that we learned was that a 6-month fitness challenge was better than a 3-month fitness challenge. The 3-month fitness challenge didn't seem to be long enough engaging throughout the year, but the 6 months seemed to hit it just right. And of course, a year is just too long. And so this constant engagement gives us the connection that we need, the relationships we need to motivate and stimulate interest on a regular basis. The second lesson learned was male and female first place winners. Initially, we were just giving a first place winner and a second place winner. But that grew old when several men in the church had been winning the fitness challenge, coming and winning those prizes, and then the females complained a little bit, and rightfully so. We changed it to first place female, first place male, second place female, second place male. First place winner is winning $1,000, which is a lot of motivation. Second place, $200. The third thing we learned was how to hold health awareness sessions. So we teach about wellness on a regular basis. Health literacy is critical to the success of a project like that. And we don't announce those health awareness sessions or have them solo by themselves. We actually combine them with other things that are going on at the church that people tend to come to anyway. So our health awareness session is combined with our Bible study. And this is just what we learned over the years. If you have a health awareness session in and of itself, people don't tend to show up in large numbers. So we've combined it over the years, and we get a good result from that. Motivational incentives is another lesson learned. We've had $500 to $1,000 prizes on the fitness challenge, and that seems to be a pretty good carrot and keeps people interested in the project. Another lesson learned would be the suggestion from the pastor of the church to have ending results be considered initial starting points, because we do this for 6 months. In 6 months of the year, you were not really engaging physically, fitness-wise, and so over the years, we have people say, well, I'll be ready when the fitness challenge starts, because they have, some wiggle room and some time to gain some weight back and participate in that yo-yo diet, and that tends to be a negative thing. So our ending results wind up being where you start the next year with your fitness challenge to cut that fluff out, so to speak. Next on the list is seeking new ideas. We've constantly had, we change up the name of the fitness challenge. So we've had individual fitness challenges. We've had dynamic duo couples where the husband and wife as a team, or just two individuals as a team, three individuals as a team. We've had as many as 5 individuals serving on teams, and we give it unique names like the superhero challenge and so forth. So we mix it up and keep it fresh and innovative and culturally relevant for the people to stay involved. And then the winners of the fitness challenge get to give us their testimony. And what we're learning is that in these testimonies, we hear people talk about getting off medications, pursuing new careers and businesses, getting back in school and retooling. So we see that the fitness challenge is more than just dealing with health and wellness status. It's giving people the motivation and the courage to take on other critical elements of their livelihood that needs challenging, that they hadn't had the courage to take on before, but they do now. So we definitely appreciate that. And then all of our fitness challenges tend to be held on Saturdays or on the weekend when most people are off work, so that we can ensure that their participation might be fruitful. Marketing and promotion of the fitness challenge happens through flyers, announcements at the church of winners and so forth, newspaper articles and newsletters. Pastoral involvement is a critical piece from the start and throughout. Usually we get their consent, but we also need their involvement. Where we've seen the leader get involved, the people tend to follow. Space for fitness assessments. Of course, you need space for fitness assessments to ensure that professionalism and privacy. And so if you don't have that space, we can help you with that. What we've seen become important for us to maintain the wellness program is to become a part of church programming. In other words, we're a part of the church budget, part of the church's programming, and therefore it's sustainable that way. And you can continue without outside resources. That's what you really want to do, is be able to contribute, start something. We started, 15 years ago with some resource, and then we learned the importance of it and was able to incorporate it into the programming of the church so that we could be able to continue and sustain without outside resources. So that's the goal here, and we hope we can get there with you. Next slide. So from this decade of excellence in faith-based health promotion and disease prevention programming, we're developing an e-notebook to serve as an educational tool for training those who are willing to go through the training to serve the wellness needs of the community. And Wellhead, Louisiana has a level 2 WellSpot designation at Grambling State University, level 1 WellSpot designation at New Living Word. And as I checked, New Living Word was the only church, I think, in the state who has that level 1 designation. Let me say that doesn't happen just because of me. That happens because of the leadership of the church and all of the things that New Living Word Ministry does aside from fitness and wellness. So partnership is critical. Let me just say that partnership is critical with other agencies. Go ahead. So these best practices for overcoming the barriers will be our instructor training manual for churches to use as a tool for creating and sustaining wellness programs or improving the existing program that you have. Go ahead. And so what are the benefits? A complete health assessment, one that could help you define existing needs and interest of the church in helping to develop the capacity to manage those interventions within the church. Pretty important. Ongoing professional training via these blended delivery services are available for community encouragers to meet the needs of the congregation. Next. Ongoing technical assistance for the community encouragers to sustain the church. And then careful monitoring of the project. And what we mean by that is the monitoring of the data that's collected, ensuring the privacy of it, and then determining points associated with each category of the 12 different measures that are taken, and then coming up with a point scale to determine who the winners might be for the fitness challenge. Go ahead. So, an ongoing opportunity to expand the network of your church also exists. So you get the chance to partner with our church, with other churches, with other organizations, all with a focus on improving health and wellness status. We may even engage in a competition between churches. I hope we get to the point where we can do that and be able to attract the interest of other people across the state. And this is a culturally relevant program as well. And we offer certificates at the end to suggest that these community encouragers are fit to serve your congregation and your community regarding developing the health and wellness status of the people that they serve. Next slide. This is an example of that WellSpot, some of the people that participate with us in the fitness challenge. We'd like to thank Well Ahead and Northeast Delta for sponsoring us and helping us to expand to other communities across the state, and look forward to coming to a community near you. Thanks so much. Questions?
We will now open the floor for any questions. Please type your questions in the Q&A box below. Okay. Please take note of the contact information provided on the screen. Feel free to contact any of the speakers or Well Ahead directly with any questions you may have pertaining to the information from today's webinar. Thank you all for joining us. Visit our website to find out more information on our programs and resources. Also, look out for our bi-weekly newsletter with updates on trainings, resources, and other opportunities. Thank you all again for joining us today and helping us moving Louisiana's health forward.